Hi, this is Justin Coyle, and I'll be presenting a project I did for the course on Information Systems for Healthcare Management, taught by Dr. Alemi at USF. For this project, I created an interactive voice response system for follow-up after an endoscopic procedure. I based the questions on a form that nurses currently fill out when contacting the patients the day after their procedures. The Therapy-Related Symptoms Checklist was developed to be a comprehensive checklist of symptoms concerning cancer patients. Its origins date back to the 1980s to the Oncology Treatment Toxicity Assessment Tool, which was developed by 4 oncology nurses for use in their outpatient practice. Phoebe Williams, the wife of my faculty advisor and USF professor Arthur Williams, further developed this tool to create the TRSC. The checklist contains 25 symptoms, 3 of which are pain, fever, and bleeding, which are common concerns of cancer patients undergoing treatment. This tool collects patient reports of the intensity of each of these symptoms. The TRSC can be completed in less than 5 minutes. If this is done before a clinical consultation, it has been shown to be helpful for clinical diagnosis and treatment. It is currently being used as a tool to improve communication between patients and providers. It is being explored as a way of collecting and documenting patient-reported outcomes. A TRSC specifically for children has been recently published and shows similar potential to the TRSC for adults. A citation of this article where this new checklist was published is shown at the end of this presentation. The article also discussed the adult TRSC. You probably already have experience with integrated voice response systems. These are the annoying computers that you talk to on the phone. The truth is that well-designed IVRs are easy to use and have many different applications. For a healthcare organization, it's likely that IVRs will allow clinical staff more time to complete other work, rather than dedicate their time attempting to call patient after patient. IVRs can be designed to collect information for the TRSC mentioned earlier. These systems have the potential to collect and document patient-reported outcomes. If effectively implemented, IVR systems have the potential to improve efficiency as well as quality in providing healthcare services. Here's the layout of the IVR system I developed for this project. It's based on the post-procedure follow-up call completed by nurses where I currently work. The caller would call into the line the day after their procedure and be greeted by an automated prompt describing the situation. They will then be asked what procedure they had done, and their answer will be recorded. The first symptom they are asked about is if they are experiencing any new pain. If they answer that they do have pain, and there are many ways this can be said and understood by the system, they will be asked to evaluate their pain on a scale of 1 to 10. If the pain is found to be mild, or less than 4, they are directed to the next symptom. If their pain is significant, they will be transferred to the nurse's station. If they answer that they do not have pain, they will move on to the next symptom, which asks if they have a fever. If they indicate they do have a fever, they are transferred to the nurse's station. If no fever is indicated, they are directed to the next symptom. This asks if they are experiencing any bleeding. If they are sent to a prompt explaining that mild bleeding is expected with some of these procedures, and asking whether or not they wanted to talk with a nurse about the bleeding. If no bleeding is indicated, the patient is thanked for using the system and our service, and asked if they would like to share any comments or suggestions with us. If not, they are sent to a goodbye prompt, and then the system hangs up. If they indicate that they would like to leave a comment, they are asked to after the beep, and given 2 minutes maximum to say whatever they want, which is recorded. They are then directed to the goodbye prompt and hung up on. These are the numbers you can use to access my interactive voice response system. The best number to use from a regular phone is 321-300-1125. I see potential for using IVRs to aid in compliance with the Stage 2 meaningful use requirements. These requirements must be met by healthcare organizations in order to receive the monetary incentives provided in the HITECH Act. This type of system can be used to collect data from patients. IVRs could be used to collect data needed for increased quality reporting requirements, and data on family history and demographic information could also be collected from the patients using the IVR. Some of the requirements of Stage 2 meaningful use require satisfactory dissemination of information to the patient. Two of the potential requirements that could be met by using an IVR are follow-up reminders and some patient education. This concludes the presentation of my IVR system and TRSC. These techniques and technologies have huge potential to change the way healthcare is delivered. The role of technology in healthcare will continue to grow and spread into every part of the delivery system. It'll be increasingly relied upon to provide quality, effective, and efficient care.